This peripatellar fat is not an area for beginners, like the leg. You know, the fat is fibrotic, and it takes a lot of work to get this out. Here, the inferior incision is being used to tunnel in the long axis of the leg from inferior to superior, using the hands to stabilize the skin. And this is difficult fat to remove, isn't it, Gerhard?
Absolutely. And when you have in different parts of the body a very easy and quick fat removal, it makes me wonder, doing cases like that, how long it takes just to form one prepatellar knee. It takes sometimes up to 20 to 30 minutes just for one knee. So a case takes an hour just to do the knees.
So fat's being removed on both the medial and lateral side of the patella, and also inferior and superior to the patella?
Yeah, absolutely.
So all the way around?
All the way around. And it's not so easy to access the anterior part, since in the shadow of the patella, just above the patella, there's like a hole, and if you want to have an excessive fat removal, then the knee would look unnatural. If you would come from the side, sometimes you have atypical wound healing, and you have indentations what also present then an untypical knee. So just when you squeeze above, as you can see here, a little bit of rest fat needs to be left, so you have a continuous nice border to the upper thigh.
So this knee will be done from a single inferior incision with no other incisions?
Well, we have sometimes 2 or 3. One certainly in the middle part, just above the middle of the patella. Depends on the kind of tissue. The less incisions you do in the knee, the better it is.
Because the scars really show on the knee.
Yes. Plus, yeah, it's more advantageous for the cosmetic aspect to use as little as possible.
So this could take a half hour for each knee alone.
Yeah. Yeah. Absolutely. And it gives you wonder that you think you have removed everything you can get, and after a little while, when you come back to a point, there's a different fat removal again. And also repositioning the knee, like bending it a little bit, also gives you a different access to different points again. So there's again additional fat, and just working your way along, after 10 minutes you see a little bit of fat in the bucket. 10 minutes later you see a little bit more, and even after 30 minutes there's 200 milliliters of fat in the bucket, and you wonder where it comes from.
Is that 200 milliliters from one knee, or 200 milliliters total from both knees?
No, just from one knee, and this can't be underestimated. These fine differences make all the difference for area like the knee.
Now, does the nurse have her hand over this medial fat compartment that will be removed?
Yeah.
Right now, that's the area that needs to be resected next.
Yeah. Former times we couldn't treat these knees, but with the vibrating devices, everything has changed, and it has a different feeling, different characteristic. Plus the stabilization gives us the possibility to work long enough with no further deep tissue trauma.
And when you're working in an area like the knee or the male abdomen, where the skin is very thick, you don't have to worry quite as much about the end hits that we talked about earlier. Yeah. Of course, you don't want to make a point of going close to the skin with the tip, but if it happens, the thick skin is really going to save you.
So with thick skin, you always have pretty good result cosmetically.